Good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer for OU Health, and I'm also the university's Chief COVID Officer. I'm going to provide you a brief update on some of the statistics for where we're at with the pandemic in Oklahoma, but I want to spend most of my time today talking about some of the news that's come out this week about other issues that we need to consider as we think about the pandemic going forward. So as of today, the State Health Department reported 302 new cases today. So the 7-day rolling average in Oklahoma is 314 cases per day. And honestly, if you look back over the past 2 weeks, we've really been very flat. We've completely plateaued at that number of just over 300 cases a day that are occurring in Oklahoma. So I want to remind people that means that more than 2,000 people are contracting COVID-19 in Oklahoma each week. This isn't over yet. The good news is that Oklahoma remains right at 9 cases per 100,000 population per day. Oklahoma ranks 45th in the nation in terms of the number of new cases per day, and that's a very, very low rate. Just to contrast, Michigan currently is at 79 new cases per 100,000 population per day. So our numbers have stayed low. They've plateaued. They've not changed, though, for a couple of weeks now. The other point I want to make about some of the data is that the number of tests that are being done for COVID-19 has gone way down in Oklahoma, and the positivity rate has gone up ever so slightly. So about 2 weeks ago, 2.3% of all the tests run in the state were positive. This week so far, we're at 3.7%. Not a huge change. But again, I think it's a trend that bears watching to make sure we don't see the positivity rate start to go up at a greater rate. And then finally, hospitalizations are completely plateaued now for a couple of weeks now. The state has been at about 200 people a day in the hospital, with just under a quarter of those patients in the intensive care unit. So I think the message when you look at the data that's put out by State Health Department today and the data over the past couple of weeks is that we've plateaued in Oklahoma. We're not seeing a big rise in cases, which is really good news, but they also are not going down anymore at this point. I wanted to highlight a few pieces of information that came out in the press this week. Perhaps the most important that everybody's been asking about is the blood clots that occurred in a very small number of people who received the Johnson & Johnson COVID vaccine. And I put in a handout that helps to explain the vaccine. So just a couple of points. Number one, the Johnson & Johnson or Janssen vaccine is a viral vector vaccine, just like the AstraZeneca vaccine that is being used in Europe. Both of them use a virus, a non-replicating virus. In other words, it doesn't grow, to actually inject a small piece of DNA that carries the genetic code from the COVID virus to make your body make spike protein. And of course, it's that spike protein that we want antibodies against because that protects you from COVID in the future. So both the AstraZeneca vaccine that's been used in Europe and the Johnson & Johnson vaccine in the United States use the same technology, different viruses, but overall the technology is the same. And we know that in Europe and other countries that are using the AstraZeneca vaccine, they have seen cases of blood clots that have occurred. And in fact, I think most of you are aware that on several occasions, use of the AstraZeneca vaccine has been put on hold in other countries. So why do these vaccines cause blood clots? And it's not completely clear. There's lots of speculation. There are some very good articles from researchers, particularly about the AstraZeneca vaccine, that show that some aspect of the vaccination, whether it's the viral vector, whether it's the DNA within the virus, whether it's the immune response that you get from the vaccine, something activates your platelets. Platelets are small cells that circulate in your blood all the time. A typical person will have 200 to 400,000 of these small cells per cc or milliliter of blood, and they are responsible for blood clotting, and they typically don't stick together and don't clot. But something about getting these vaccines seems to activate those platelets. They come together, they clump, they clot, and it creates those clots that have been described both for AstraZeneca and the Johnson & Johnson vaccine. When you see one of these patients and you check their blood count, their platelet count is very low because it's what we call a consumptive coagulopathy. In other words, the platelets have been consumed. They're being used in the clot, so the platelet count is low, but the person has clots. So characteristically, when you see these patients, we have a medical condition that we see periodically from this. These patients have clots, but have low platelet counts. So we treat them differently, and that's very important to understand. So I think, at least with the AstraZeneca vaccine, where a lot of research has already been done, we have a pretty good sense of what may be happening. The question is, why does it happen? Are some people genetically predisposed to it? Is there a small cohort of people who already carry antibodies against platelets, and we may just stimulate the immune system and make it? We don't know the reason for that. It's very rare. Less than one person out of 1 million doses of vaccine have had these reactions in the United States, but I completely understand why FDA and CDC decided to take the time to study the cases very carefully and to see what is happening. So I just wanted to give just a brief sense of kind of why this is happening. And when I said in another interview not long ago that I wasn't surprised it happened with Johnson & Johnson, it's only because I had seen the multiple reports come out of Europe with the AstraZeneca vaccine, which uses the same technology to vaccinate against COVID. Another thing that's hit the news a lot over the past few days is breakthrough infections from virus, so from the vaccine. So you're fully vaccinated. You've received both doses of Moderna or Pfizer vaccine, or you've already received your dose of Johnson & Johnson, and then subsequently, 8 weeks later, 10 weeks later, you test positive for COVID-19. We've seen some of those cases in Oklahoma. The United States, the CDC reported 5,800 cases where that's happened, but I want to highlight that's out of 76 million doses of the vaccine. The rate of breakthrough infections is very low. But the point I want to make is no vaccine is perfect. We knew from the clinical studies of these vaccines that they were only 94 to 95% effective. Very, very good for a vaccine. But 4 to 5% of people who get these vaccines could go ahead and develop COVID in the future. That's what happened in the clinical trials. So it's important to remember that no vaccine is important, and it's part of the reason that we're still encouraging people to wear masks, because just because you're fully vaccinated does not give you a 100% guarantee that you won't get COVID again. And if you do, typically you won't get nearly as sick, but you could spread the disease to somebody else. And I gave a list of examples from around the country of different states that are actually counting the number of breakthrough infections. And again, if you calculate the percentage, it's very, very low. It's less than 1% in all circumstances. So these vaccines are really good, but they're not perfect. The second point I want to make, and another reason that we're still encouraging people to wear masks, even if you've been fully vaccinated, is that we know that there are populations of people where the vaccines aren't going to work as well. So there are a number of studies now, particularly looking at patients with cancer, that show that some of these patients will not develop a strong antibody response to the vaccine. And just remember, when the companies did the studies that showed that these vaccines were 94 to 95% effective, they typically did not enroll immunosuppressed patients, patients with cancer who are on chemotherapy, or others who may not respond to the vaccines very well. So I think, again, the trials were done in primarily healthy adults, not patients with immunosuppression. So I provided several different studies that highlight this. One of the studies was done, a very small study done out of Johns Hopkins, that looked at patients who had had solid organ transplantation, kidney transplants, liver transplant, those types of transplants. And they found that after the first dose of the Pfizer vaccine, only about 17% of the patients who received dose 1 developed antibodies, nowhere close to the 70% or so that we're typically expecting with the first dose of those vaccines. So it was one of the first studies that just reminded us that these vaccines may not work as well in people who are immunosuppressed, because remember, solid organ transplant patients take immunosuppressive drugs so they don't reject their organs. There have also been a number of studies now in cancer patients, and a study from the University of Pittsburgh that looked at both bone marrow cancers, leukemias, lymphomas, and things like that, found that the vaccine didn't work nearly as well. 46% of the patients who had non-solid tumors did not develop antibodies, and 77% of those that had certain blood cancers like leukemia did not develop antibodies. So once again, just remember, whether it's in your family or in your community, there are going to be people who have cancer who are immunosuppressed, who may have been fully vaccinated, but they're not going to be nearly as well protected as others. And then the final study that I put in the handout was a patient study with elderly patients who had either cancer or leukemia. The cancer patients who had solid organ or solid tumors, only 39% of them produced antibodies. Only 19% of the people with leukemia produced antibodies. So just remember that if you know people have them in your family or others, please do them the courtesy of wearing a mask, because they still could be at risk of COVID-19. So my daughter sent me a picture a number of years ago. I used to go around the country lecturing on adult vaccination, particularly around influenza, and she sent me a picture that came out of Portugal that basically highlighted a point I'd made over and over again about the influenza vaccine. I'll make the same point about the COVID vaccine. I can guarantee you that if you don't take the vaccine, it will be 100% ineffective. It won't prevent anything if you don't take it. So I still encourage everybody to get the vaccine if you want to prevent your disease. So, to kind of summarize, regardless of how well we do in Oklahoma with vaccination, there are going to be people in our communities, potentially in our families, who are still at risk of COVID-19. We have to expect it because they are particularly vulnerable. The other thing I think most of us believe is that COVID-19 will become an endemic infection, meaning that every fall, every winter, potentially, we'll see outbreaks. Outbreaks in people who are at risk, outbreaks in people who never took the vaccine, and it could have substantial impact on us for the future. And that brings me to another point that I've mentioned a time or two before. One of the things we don't yet know well about the virus that causes COVID-19 is, will this be a seasonal infection? Think about common colds. You tend to get them more commonly in the fall and winter. And although you may once in a while get one in the summer, the reality is that most colds happen in the fall and winter months. Coronaviruses cause colds, rhinoviruses and others, but many viruses that infect humans are seasonal, which means some of the drop in the number of cases that we've seen over the past couple of months now may be a natural characteristic of the virus to be seasonal. And there are a lot of people, including the Institute for Health Metrics and Evaluation, that have now suggested that we may see increases in the number of cases in the fall and winter. That's when we may see outbreaks, and they just simply warn us that we need to be prepared for that because the virus may be more active in the fall and winter. One last study that I mentioned was a study about the cost of this. So I'm working with some health economists now looking at the overall impact of COVID-19 on economics. We know that it's had a devastating impact on businesses. It's had a devastating impact on health care. But one of the points that this particular study made was that there's a good chance that it will impact our health insurance premiums going forward. If we have large numbers of people who don't get vaccinated and get COVID-19, we'll all pay for it in increased insurance premiums going forward. So this was a study from the Kaiser Family News Foundation that basically showed that we need to be thinking about whether or not we have higher healthcare costs in the future because people don't get vaccinated. Remember, not all patients who get this disease, in fact, the majority don't end up in the hospital, but those that do, sometimes those costs are incredibly high on society. So I'll stop there. I know there are many, many questions today.
breakthrough virus, I was just curious, they're not saying any of those are like variants. They're just saying these are just the basic virus?
No, so the question is about breakthrough infections or breakthrough cases where somebody's been fully vaccinated. Are those variants? Well, we know in the United States now that the predominant strain causing infections is the UK variant. So I would argue that a lot of the breakthrough cases that are occurring are the UK variant. But just remember that the UK variant, although it spreads easier, it doesn't seem to cause more severe disease. But the problem is if somebody's not vaccinated, they're more likely to get infected. And again, these vaccines simply are not 100% perfect, and you could get infected with any COVID strain that happens to be circulating in the population. So again, if you look at the CDC study, they reported 5,800 breakthrough cases out of 76 million doses. The proportion of people who get infected is well below 1%. The vaccines are very, very good, but they're not perfect.
Get right at it. Do you think there is hesitancy surrounding the vaccine now more than before?
So the question is about hesitancy. Do I think there's more hesitancy now than there was before? So if you'd asked me this question 2 weeks ago, I would say no, hesitancy has gone down. Multiple polls were showing that more and more people were willing to take the vaccine as they saw their neighbors, their family members get the vaccine and do just fine with the vaccine. Also, we know that there are benefits of getting vaccinated. You don't have to quarantine if you're exposed to somebody. If you decide to travel, you don't have to quarantine when you come home. If you're exposed at work, you can, or you're exposed to somebody in your home, you don't have to quarantine away from work. You can come back to work and not lose that income. So there are a lot of good benefits of being vaccinated now. So my general sense was that hesitancy had gone down, although there are still a lot of people who are reluctant to get the vaccine. What happened with Johnson & Johnson this week may have had an impact. I think it created some concern for some people, particularly about that vaccine. Again, I want to highlight that the risk of that event was less than 1 in a million doses, which is infinitesimal compared to the risk of getting COVID-19. But I understand that people are worried that it is a serious side effect when it happens. And so there may be some enhanced hesitancy about that. I will point out in Oklahoma, we have plenty of Pfizer and Moderna vaccine. So please don't hesitate to get vaccinated. If you're concerned about Johnson & Johnson, seek out one of the clinics that's providing either the Pfizer or Moderna vaccine right now.
Okay, are we close to reaching herd immunity?
Yeah, so the question is, are we close to reaching herd immunity? And it's a complex answer, and it's also somewhat controversial. So if we just look at vaccination rates, we're nowhere close. Only about 25% of Oklahomans are fully vaccinated, meaning we have a big chunk of Oklahomans who do not have immunity by vaccine. I will point out that we know that a lot of Oklahomans got COVID-19, more than the 400,000 people who tested that positive for COVID-19. There were a lot of people in the community that got COVID-19 that never got a test. But it seems that increasing data is showing the people who have natural immunity, they got infected, survived, have antibodies, that protection may not be as strong as the protection you get from the vaccine. And there's reasons for that, but the vaccine, remember, causes you explicitly to develop antibodies against spike protein, which is how this virus spreads from one person to another and how it attaches to your body. So it appears to be much more effective at generating immunity. So there is some combination in the community of people who've had COVID-19 and have some natural immunity and those that have gotten the vaccine. There's quite a bit of overlap. A lot of the people that we've given COVID vaccine to already had COVID. So I don't think we're to herd immunity yet. Our epidemiologic models that have been developed by Dr. Wendelboe suggest that by summertime, maybe late summer, we may be approaching herd immunity in Oklahoma. But again, that assumes that the immunity from previous infection holds up. And right now, the studies are suggesting that maybe that immunity isn't quite as good as being vaccinated.
Okay, to take that a step further, if we don't reach herd immunity, is there a concern that variants could take more of a hold and spread?
Yeah, so I think, so the question is, if we don't reach herd immunity, could variants take a hold and spread. I will tell you, the variants are already in Oklahoma. They're the predominant strain in the United States. We've seen what's happened in Michigan. So if we saw a larger outbreak of the UK variant, as an example, in Oklahoma, and we had a lot of people who did not have immunity, then yes, it could spread quite rapidly. And that's one thing we know about the UK variant. It spreads from person to person more readily than the previous strains.
Okay. Does blood type play any role in people getting COVID-19 or not?
Yeah, so there have been a lot of studies, mostly what we would call observational studies, about whether your blood type provides any protection or keeps you from getting as sick. And again, if you'd asked me this question a few months ago, I might have suggested that there was some evidence that people with type O blood maybe didn't get as infected as often, but it didn't confer any particular protection from severity of illness. But a large study came out this past week and suggested that there was no association or protection based on blood type, much larger study. And I just don't think we have enough evidence to say that blood type gives you any particular protection at this point in time.
Okay. About 26%, well, you said 25% a minute ago, of Oklahoma's population is fully vaccinated. Is that where you'd expect us to be, or did you think it should be higher by now?
So the question is, did I think we should be higher than 25 or 26% of our population fully vaccinated at this point? I will say we came out of the gate very strong. Oklahoma was ranked 10th, in the top 10 of states that were distributing vaccine early. We're actually falling back now as other states have overtaken us in the proportion of the population. So, and I think all of us are aware that we've been seeing these large vaccination pods that aren't filling up. So people have, some pod may have 10,000 doses available, but only 5,000 people sign up. So I think we have slowed down considerably. I think it's incumbent upon us to make sure that we continue to promote vaccination, because we're not in the top 10 anymore, and that's because other states have caught up.
Okay. At the rate we're going now, when would we hit 50%?
Well, I don't know. I mean, right now, so the question is, when will we hit 50% vaccination? I don't know. I mean, we're in the 25% fully vaccinated. We know that a single dose of the vaccine, Moderna or Pfizer, confers some protection. Ideally, we'd get everybody fully vaccinated. But I think it's going to take longer to get from 25 to 50 than it did to get from 0 to 25, just because the uptake of the vaccine has slowed down.
And with J&J out of commission, is that slowing our efforts down some?
So I know that when we did the vaccination pod at the state fairgrounds with the Oklahoma City County Health Department last week, Johnson & Johnson was very popular. There were a lot of people that wanted to get the one shot, I'm done vaccine. People that don't like needles, don't like getting shots, they like the Johnson & Johnson. Johnson & Johnson has some advantages for places like doctor's offices because it comes in a vial of only 5 doses. Now remember, once you draw 1 dose, you have to use all 5 doses that day or you end up losing them. But it does have the advantage, whereas Pfizer is minimum 6, sometimes 7 doses, and Moderna is 10 doses per vial. So there's some advantages to Johnson & Johnson that were helpful. You could store it in a refrigerator for long periods of time without freezing it, which also lent itself to pharmacies and doctors' offices. So I think there are some people out there that were looking for that one-shot option, and that may slow down. But again, I want to highlight that the state has plenty of Pfizer and Moderna vaccine. So please keep seeking out the vaccine. You can get vaccinated.
Okay. There have been so many disagreements during this pandemic, from mask mandates to misinformation. Do you think vaccinations have served as a form of unity for Oklahomans?
So have vaccinations served as a form of unity? Well, I've gotten to participate in events now that OU Health has participated in. I think our system has given more than 50,000 doses now, and it's been remarkable to watch the people that come in to get the vaccine. So happy to finally be able to get the vaccine and take some of that weight off of them, that they could be around family, children, grandparents, things like that. So I think that has been something that's brought a lot of us together. It's been fun working in these group events where you bring community partners together and healthcare workers to deliver the vaccine. We had a lot of fun at the health department. We were partnered with SSM, Integris, Mercy, and OU Health, along with the Oklahoma City County Health Department, Emergency Medical Services, fire department, and other. So that was a lot of fun to bring all those healthcare providers together. So I think that's been uplifting for a lot of us. We just can't slow down yet. We need to get the vaccine out more.
Okay. For about a month, the State Department of Health's risk map showed us much of Oklahoma, central Oklahoma, as being in the yellow. This week, multiple counties in central Oklahoma have gone back to orange. Is this a sign of a surge, or should we be concerned?
So I think it's an artifact of those 1,200 additional cases that were reported by the state health department on April 7th. So remember, there was one lab in the state that wasn't getting all of their data to the state health department for positive COVID tests. And on a single day, the state health department dumped all of that data into it. I looked yesterday at the county level data, and what that showed me was that there was a big jump in the number of cases, particularly in some of the metropolitan areas. So my suspicion, I don't know what lab it was, but my suspicion is that it was a lab that had locations that were largely in the metropolitan areas, and their case counts artificially jumped a lot this past week. I think if we wait 1 week, we're going to see that effect completely go away, and I think it's possible that the map will change colors within a week if it's truly due to that. So far, I just have not found in any of the data that I look at any evidence of big jumps, increased number of cases. Case counts have been up slightly. Positivity rates are up slightly, but Oklahoma's staying right at 9 new cases per 100,000 population per day, and it's been there now for several weeks.
I'm sorry to go, but let's go back to the vaccine breakthrough cases again. If you could just maybe expand on what do these breakthrough cases tell us about how we should behave post-vaccination?
Yeah, so the question is, what do breakthrough cases tell us about the way we should behave post-vaccine? And I think that's in particular why I wanted to highlight that. I think if you're fully vaccinated, there are a lot of things that you can do safely. Certainly outdoor events, I think for the most part, you can do safely. You can get together with small family gatherings, particularly when you know you've been vaccinated, your family has been vaccinated. Those are very, very safe. And I mentioned some of the benefits of vaccine. If you travel, you won't have to quarantine when you come back. But I also, that's part of the reason I highlighted the issues about people in the community that will still be at risk of this disease even if they've been vaccinated. If you have family members with cancer, if you have family members that have organ transplants, people that are on cancer chemotherapy, people who are immunosuppressed, maybe they have an autoimmune disease that requires them to take immunosuppressive drugs. Even if they've been vaccinated, there's pretty good evidence emerging that they won't get as robust of an immune response to the vaccine. So out of courtesy, I'm encouraging people, if you're around those people, if you're in the community, to wear a mask to protect everybody around you.
Okay, so you've talked about that people, the interest in getting vaccinated has begun to plateau. This reporter is asking, what can be done? How can we work to make people feel more comfortable about taking the vaccine?
Well, I think a lot of it is person-to-person contact, making it easier for people to access the vaccine, get vaccine into the communities. I really am a strong proponent for getting vaccine into doctor's office. As I pointed out before, if I'm seeing a patient in the office with diabetes and lung disease, and I talk to them and explain to them their risk of complications of the disease if they don't get vaccinated, I can often convince them that they should get the vaccine. It would be ideal then to be able to immediately give them the vaccine while they're there in the office so they don't have to go out and seek it somewhere else. I think those the types of activities. I know the state health associations have all come together to create some public service announcements to promote vaccination, working very closely with the tribes, which have done a great job of delivering vaccine to so many people. I think a large part of it's from folks like you, April, the marketing people, that are going to have to help us get the word out, see other people who've safely been vaccinated, understand that it's safe, and the vaccines are very effective.
Monks with OSMA says Oklahoma ranks dead last for testing of variants. Is this a bad thing?
Yeah, so Dr. Monks, who was the past president now of the Oklahoma State Medical Association, has highlighted several times that Oklahoma has a very, very low rate of performing genomic sequencing on positive tests. In other words, seeing if we have variants, doing variant testing. On a press conference earlier this week, Dr. Michael Kaiser, who's now working with the state's public health laboratory, Mike is a highly trained geneticist, and they've acquired equipment in the public health lab, and he tells me that will have the capacity in the near future to do potentially up to 700 genomic sequences per day. So I think Oklahoma will be doing a lot more virus genomic sequencing. Dr. Kaiser is just the type of person that should be leading those efforts with his extensive experience in genetics, and I think we're going to see a lot more of it done in the near future.
Great. Okay, we will end with, you've already kind of talked about this throughout, but we've seen people let their guard down, not wearing masks, not social distancing, going to parties without precautions. What does this mean to you? Could we end up like other states and see our cases drastically increase?
So the question largely is, people seem to be letting their guard down, going to parties, not wearing masks, doing things like that. Could we see a big surge in cases like other states like Michigan or Minnesota? And the answer absolutely is yes, we could. A big chunk of Oklahomans are not yet vaccinated, probably don't have good immunity. Many who have complex medical problems, chronic disease, who are at risk of the complications of COVID-19. So it only takes a few super spreader events to really see a large increase in the number of cases. I know Illinois not long ago saw a super spreader event when a bar in rural Illinois opened. The capacity in the bar was 100 people. 26 people in the bar that night got infected with COVID-19 and infected 20 more people in the community. If you're in populations of people who haven't mostly taken the vaccine, and you have somebody that's quite infectious, perhaps with a UK variant strain or something that spreads very easily, we could absolutely see the number of cases go back up again.
Okay, don't have any more questions. Anything else you want to add?
Nope, go seek the vaccine.